This week, the Surgical Skills Lab at MUHAS had the privilege of hosting a plastic and a reconstructive surgeon from Sweden with expertise in microsurgery. His visit was part of Operation Smile initiative aimed at training plastic surgeons in microsurgical techniques.
My name is Jonas Löfstrand. I'm a plastic surgeon from Sweden. I focus on microsurgery and reconstructive microsurgery. And I am invested a bit in Operation Smile and their voluntary programs to go and teach plastic surgery in Africa. So we have been in Rwanda first, and now we're coming here to Tanzania to try to teach microsurgery. And one part of microsurgery involves anastomosing small vessels. So that's something that everyone who's going to conduct that kind of surgery needs hands-on training for. So the skills lab was pretty good to have in order to make the plastic surgeons be able to train to connect vessels, and now they're doing it in loops. So we have bigger vessel models, which are chicken tracheas, and they train with the 6-0 choline, which is sufficient as a starting point.
Using realistic surgical models like chicken tracheas for vascular anastomosis practice, I'm pretty sure our vascular team has improved their precision in suturing and microsurgery. I'm just curious, how do you feel about their progress under your guidance, and have you noticed any improvement?
Yeah, so for this session, we just starting up the project. So this is our first visit here, but hopefully we will be here several times in the future. So this is just for them to get a taste of it. But I think with the help of the lab and the senior plastic surgeons, they can probably come back and do some more training even when we're not here. And hopefully when we get back in later visits, we can have some small microscopes that we can use and maybe train on smaller vessels. The reason I came here was because Operation Smile asked me. So it's not that I have taken any initiatives in that direction, but it's Operation Smile came with the suggestion. But then through the discussion with the university reps and the doctors here, they told us that there was a nice skills lab and it was available to use. And as we've seen the past couple of days, that it's pretty frequently used by other specialties as well.
Yep.
With the cardiothoracic and the peds and everything. So it's great that the plastics can use it as well for skills training.
In this talk, Dr. Jonas shares insights into his motivation for collaborating with our lab and the team, but also he added on a little bit his experience on working with the plastic surgery team at Muhimbili National Hospital, and he concluded actually with a key message for stakeholders and future surgeons.
I'm definitely positively surprised to see the drive that they have to improve the care they can provide to the patient, and unselfishness in their approach to this. So it feels right that we try to provide the same kind of drive to help them to move forward. Yeah. I mean, there are two messages I can give, and it's that the only way to become good at something is repetition. It's repetition to acquire skills and get better. And in order to do that, of course, you need facilities that allow that. So you train here and you don't train on the patients. And but of course, that involves some sort of cost as well. But education is expensive.
Absolutely.
But ignorance is more expensive.
It's more expensive, for sure. We extend our deepest gratitude to Dr. Jonah, alongside with Operation Smile, for their dedication to advancing surgical training in Tanzania. We look forward to future collaborations and even greater learning opportunities. The key takeaway for this talk is the only way to become good at something is repetition, repetition, repetition. And also, Dr. Jonah added, education is expensive, but ignorance is more expensive. That was Dr. Jonas Löfstrand from Sweden. Thank you so much